Hi, my name is Dr. Sean Price, chiropractic physician and clinical director here at Chiro Spa in Fort Walton Beach. And over the next several weeks, we're going to be doing a series on low back pain and more specifically, more of the serious low back pain that has chronic conditions associated with it. In other words, low back pain that maybe started off as we were younger, but as life has progressed, it's progressed further and further and led into degenerative joint disease, herniated disc, bulging disc, osteophytes, arthritis, things along those lines. But the first thing I want to make very clear is I want to talk about stenosis, because most of the time when you get an x-ray report or an MRI report, you're going to hear the word stenosis. And what does stenosis mean? Well, basically stenosis is narrowing. So for example, if you're looking at the spine from the side, now forgive my artwork here, but these individual blocks are going to be vertebrae. In between these blocks, you're going to have discs. And then you have the spinal cord running along the back. And you can see right here, I've drawn an example of a disc that's herniated out. So it's narrowing that spinal cord. So that's narrowing of the spinal canal due to a herniated disc. If you take these vertebrae and you kind of turn it, this is looking at it from the side, if you take it and twist it up like this, then you would be looking at it from the top. So this would be the disc, this would be your spinal cord, and these will be the spinal nerves coming off. So you can see if a disc is herniated, then it's sitting out and it's narrowing off that path or that hole where the nerve can come out. So it's a narrowing of a pathway. Sometimes it can be a narrowing of what we call the intervertebral foramen, which is this area over here. Sometimes it can be the spinal canal. So stenosis equals narrowing. Now what can cause stenosis? There are a lot of different things. It could be misalignment of the vertebrae, which is your basic subluxation from chiropractic, could be narrowing that IVF or that hole where those nerves come out and be putting pressure on the nerve. It could also be coming from a disc bulge. It could also be coming from arthritic spurs where the condition has progressed far enough that there are bone spurs developing and they can cause that narrowing in the canal. So a lot of times these things will go by different names. You'll have sciatica, you'll have DJD, which is degenerative joint disease. You'll have DDD, which is degenerative disc disease. Bulging discs, herniated discs, slipped discs, pinched nerves, arthritis. All these different terms can all be representative of the condition of stenosis, which again is narrowing of that spine. So what can you do about it? Well, we're going to go into a lot of detail over the next several videos, but with the techniques that we use in our office, we use brain-based therapies to help support and balance muscular function. We use, of course, chiropractic adjustments to realign the vertebrae in the spine. We use nonsurgical spinal decompression, cold laser therapy, postural rehab. There's a lot of different things that can be done, but we'll get into that as we go through this process. All right, I hope this makes sense. If you have any questions, please feel free to post below.